Hi, welcome to the second episode of Dr. Nagy's Orthodontic Q&A. I hope you're having a great weekend. It's a little bit cold, but hopefully things will warm up soon. Last week we had a question of why we would do phase 1 orthodontics for a child, and a lot of you had great answers and questions, and we'd like to thank you for your participation on our Facebook post. And this week we're going to discuss the answer to that question, and we're also going to post the two winners of our drawing, random drawing for the $25 Tim Hortons gift card, and we will have a grand prize at the end of March for an Apple Watch that we're going to post at the end of March. So to answer the question to our last week's video, which is why would we do phase 1 orthodontics for a child, really goes back to the problem that it seems like children are getting more and more crowded. They're having more and more orthodontic problems, and it's very well documented, and it's not just happening in our town, our county, or in our country. It's happening really worldwide. It's happening in Europe, South America, Asia, Russia, Europe, and it just all of the children's mouth just seems to be getting smaller. We see a lot more overbite. This is an example of overbite, which is class 2. We see a lot more underbite, and here's an example of an underbite, which is called class 3. And we also see a lot more constricted, which is narrow, small arches. When a child has narrow arches, a lot of times the teeth doesn't have enough room to come in, and later in life, oftentimes the only thing you can do is extractions if you wait too long. So basically with phase 1 orthodontics, our goal is to make an orthodontic problem less severe and to help to move that patient's problems from severe to more mild for the second part. And sometimes in the second part not even needed, because all the teeth come in, and some children even have really straight teeth by the second part of the orthodontic treatment, and all they need is just monitoring. And for those of you that are interested in literature and journals for evidence for this, I'm going to post a research that was done for this, where they studied children with severe orthodontic problems, moderate and severe orthodontic problems. They treated them early, and they showed that it made a huge impact for later in life of how much easier it was to finish the orthodontic treatment, as well as to move their problems from a really severe problem or moderately severe problem to really just basically an elective issue. And some of the reason why it's important too, well, one thing we talked about, if you have really narrow arches, the teeth may not even have room to come in, and then if you wait too long, you may even need extractions. If you have bone problems, like skeletal problems, where the jaw is too far back or the upper jaw is too far back, a lot of times if you wait too long, the only way to correct that after teenage years, and usually they are corrected around after age 18, is surgery. So I'm a big believer that I think we should treat those orthodontic problems early to really, just like this research article showed, to really help these children from moving from more severe to really just an elective problem. And here, let me show you an example. So here was an 8-year-old patient, and he had a problem where it looked like his jaw was really strong, but actually his upper jaw was too far back. And one of the problems with having your maxilla, which is your upper jaw, too far back, it can obstruct your airway too, along with large tonsils. So if your upper jaw is too far back, it pushes on your airway, and it can actually lead to sleep apnea, which is a serious condition that if you let it go on, actually becomes a permanent problem. It seems to, literature supports it, that if you treat it early, it actually it can be cured, and it will go away. But nevertheless, also the facial aesthetics from when your maxilla is too far back is not very aesthetic. For a lot of patients, don't like it. So and it's fairly easy to treat on a young child, and it's very difficult to treat on an older child or an adult. So we're firm believers that any patients who have a maxilla that's too far back, and that creates a strong, what seems like an underbite, and it creates this more of a flat or even concave profile where the midface is further back than the forehead and the chin. Those children, it's very important to treat them early to move them from this severe condition to a more mild. So in this patient, we did exactly that. We treated him when he was about 8 years old, and I think the results speak for themselves. And really, he was very compliant with the appliances and the treatment, and we were able to move his maxilla forward. And I think you can see from his facial aesthetics what an improvement it made. And it's and a lot of these children, it's not just that their profile looks much better, but it's also they're a lot healthier. Like if they were snoring before, a lot of times that clears up, or if they were having airway problems, a lot of times this treatment helps that as well. And it's been very well documented, and I'm going to post the literature here. And really in this literature, they showed exactly what I'm describing here, where when they took several children with severe and moderately severe orthodontic problems, and they treated them early with phase 1 orthodontics, they were able to move their problems to a more elective, which is just optional treatment. So basically they were able to improve their orthodontic problems so much that later in life the orthodontic treatment is just basically optional. So I think that's fantastic, and we're very excited to be able to offer these services for our patients. If you have any questions, please always feel free to let us know. And we are going to have a question for next week. And our question for next week is, what do you think would be a problem if a child's front teeth seems to be more forward than the lower jaw, basically the front teeth sticking out? What risk do you think that would pose to a child if that's the case? And so please post your answer below this video on Facebook, like our video and share it, and we will enter in for our next drawing. Again, the question is, what risk do you think it would pose to have two front teeth sticking out in a child, and what problems that may lead to? And here I'll show you an example of that. What do you think would be the problem of having this orthodontic problem? And now it's time to announce the winners for last week's random drawing for the $25 Tim Hortons gift card. And the winners were... Congratulations, and thank you for your participation. And don't forget, if you post your answer below this video in a comment section, and you like our video, and then you also share it on Facebook, we will enter you in for next week's drawing, as well as we will enter you in for the drawing for the grand prize that will take place in end of March. We also offer exams and free exams and consultations for braces and Invisalign. So if you feel like that your child may need orthodontic treatment, or you have any questions, please don't hesitate to call our office and schedule an appointment. We'd love to see you. Dr. Misha and I would like to wish you a very happy 2018. We hope that you're having a great weekend, and we hope to see you soon. Have a good day. Bye.